everyone. Today we will discuss about one of the communicable diseases. It is one of the vector-borne diseases and also the treatable disease. I think you all are well known about the Kala Azar. What do you mean by Kala Azar? Kala Azar, it is also called visceral leishmaniasis. It is a parasite disease caused by the Leishmania dinovani. The etiological causes is the causative organism is the Rhizomonia divani, vector the female sandfly. Reservoir is the human. Epidemiological, most of the countries can affect this kind of disease, like West Bengal, UP, Bihar. The affections of poor rural populations situated with the malnutrition and the poor housing. The mode of transmission, bite of infected female sandfly, not transmitted by the direct contact, rarely through the blood transfusions. The pathological pathophysiology, parasites enter the bloodstream after the sandfly bites, in which the macrophages affect the spleen, liver, bone marrow, leads to the anemia and immunosuppression. Clinical features prolonged irregular fever, less than 2 weeks, weight loss and weakness, sleep, splenomegaly and hepatomegaly, anemia, darkening of the skin, the black fever, it is called as the black fever. The complications severe anemia, bleeding, tenderness, and secondary infections, death if not treated. The diagnostic evaluations, first of all, the history collection throughout the history, you have to uh, collect the patient details and the environmental detail and also the past and present detail can be collected. Then head to foot assessment have to assess the abnormalities, what are the abnormalities can be find, and what are the abnormalities indicates can some other reasons. So, what are the abnormalities and the infections can be find out? Then the rapid diagnostic test, then blood examination. Under the blood examinations, you have to collect the RBC, WBC, and total blood count. Then the HP can be collected. Then bone marrow aspirations, the bone marrow aspirations to collect the color changes and the consistency, then any other infections present. These are all the things we have to collect from the, these are all the history can be collect from the bone marrow aspiration. Then CBC shows the anemia and the low WBCs. Then the treatment, the most of the people can be provide a symptomatic treatment. So the patient can be different from one person to another person. That's why we have to provide a so symptomatic treatment. The liposomal, it is a main drug to provide the Kala Azar and the permomycin and the early treatment to reduce the mortality rate. It can be prevent for the morbidity. The national program under the Kala Azar, the India's can we provide some programs to prevent untreated to the diseases. First one is Kala Azar Eliminations Program, then early diagnosis and complete the treatment, then indoor residual spraying to surveillance and the case reporting. Prevention and control. Use the insecticide treated nets, indoor residual spraying, improving the sanitation and housing, health education, early diagnosis and treatment. To improve the sanitation, it is very important because the improper hygiene can provide the many other diseases because for example the vector-borne diseases can under the poor hygiene and environmental poor sanitation. To educate the community peoples to how to prevent the infections from the vectors and the animals. Those are all the things how to manage. The nursing management, monitor the vital signs regularly, such as the spleen and liver enlargement. Check the pallor and bleeding. Administrations of prescribed anti-lesbian drugs provide a high protein and high caloric diet. Encourage the adequate fluid intake. Maintain the personal hygiene. Prevent the infection and sandfly bites. Educate the patient to complete the Will treatment. Some people can think the symptoms can, when will they reduce, they can stop to intake of the drugs. That type of people can educate, prolong the course. You have to take the medication. The type of peoples to educate how the treatment is effective and what are the complication can withdraw the treatment. Health education, use the bed nets, keep the surrounding clean, complete full courses of treatment, seeking the medical help for prolonged fever. Conclusion, it is a life-threatening but treatable disease. Early detection and proper treatments are essential. Community awareness play key role of infections. Thank you.